Hey everyone, Dr. Shahid here. Welcome back to another video, and today we're going to be briefly discussing some miscellaneous topics and the key things you need to know about pulp, cusps, and grooves. Let's start by discussing a vital component of our teeth, the pulp, which houses nerves, blood vessels, and even connective tissue. Now the key thing you need to remember here, guys, is that during odontogenesis, the dental papilla develops into the dental pulp. Definitely remember that. Now, as differentiation continues and our tooth starts to take form, eruption occurs when about 75% of the root is fully formed, and the crown of the tooth will first emerge and the root will continue to grow thereafter. Once our tooth has fully developed, so has the pulp. We can now divide the pulp into the radicular pulp and the coronal pulp. The coronal pulp is the upper half of the pulp, while the radicular is the one near the bottom inside the roots. Now, a key component located within our coronal pulp are the pulp horns, which are extensions of the pulp that extend to the cusps. Within our radicular pulp, we may have lateral canals, which are accessory canals that branch off the main root canal. And in this portion, we also have the apical foramen, which is the main opening at the apex of the root for nerves and blood vessels to access the tooth. Next, we'll discuss the law of concentricity, which is best seen if we section off the crown right through the cementa-enamel junction, which is where the enamel of the crown meets the cementum of the root. So, the law of concentricity states that the pulp chamber walls are concentric to the external surface of the tooth at the level of the CEJ, meaning the shape of the pulp chamber at the level of the CEJ matches the shape of the external tooth surface. So this gives the clinician important information for endodontic access. For example, you can see here that if there is a bulge of the CEJ in any direction, our pulp chamber will also follow suit and extend towards that direction. So this is very helpful to know. Okay, let's now talk about cusps. These are very important, as you can imagine, for your molars. So let's take a closer look at the maxillary molars. And we'll begin with the first molar, which is 4 cusps. We have the mesial-buccal cusp, the mesial-palatal cusp, the distal buccal cusp, and the distal palatal cusp. However, you can see that there's another unique portion highlighted in green on our maxillary first molar. This is known as the cusp of Carabelli, and it isn't technically a real cusp, but rather an accessory cusp. Okay, moving on to the maxillary second molars, we see the same 4 principal cusps, nothing crazy here. However, interestingly enough, the third molars can vary, and oftentimes they will only have 3 cusps. They are usually missing the distal palatal cusp, and for that reason, the mesial-palatal cusp, shown in yellow, is often referred to as just the palatal cusp. Alright, let's now move on to the mandibular teeth. More specifically, we're going to hone in on the mandibular molars. Starting with the mandibular first molar, we're able to appreciate 5 different cusps, and it's important to note that this is the only tooth in the whole mouth with 5 cusps. They are the mesial-buccal cusp, distal buccal cusp, mesial-lingual cusp, and finally the distal lingual cusp. Now, both of our second and third mandibular molars only have 4 cusps, and they're going to be missing that distal cusp that we see on the first molar shown in green. Alright, let's move on. While we're on the topic of mandibular molars, you should also be aware of cracked tooth syndrome. Now, I talked about this in the endodontic video series, but it's a concept that's important to know for the exam, so we'll introduce it here as well. For now, just remember that the mandibular second molar is particularly susceptible to cracks because it takes on significant occlusal forces during chewing, making it more prone to stress and fracture compared to other teeth. Alright, now let's move on to another component of teeth, which are grooves. Grooves are simply depressions and fissures on the chewing surfaces of teeth, most commonly found on the molars. Now, there are a few distinct grooves and facts you should know, and the first one will concern the mandibular second molar, which has a buccal groove, shown here in blue, and a lingual groove, shown here in red. And all you need to know is that for this specific tooth, these 2 developmental grooves are continuations of each other. Okay, let's now move on to our next notable groove, which is the palatal gingival groove located on the maxillary lateral incisor. This is actually an anomaly and it's not always present, guys. But this developmental deformity extends from the cingulum of the maxillary lateral incisor down onto the root surface as shown here. Now, most of the time, this groove doesn't really bother us, but it certainly does create a crevice for bacteria, and so it can sometimes pose a periodontal and endodontic risk. Alright guys, that pretty much covers the high-yield information for this topic, so let's now try some practice questions together. And the first question reads, each of the following is found at the radicular pulp except one. Which one is the exception? So pause the video if you need, and the answer is A, pulp horns. So as I mentioned earlier, the mature pulp can be broken down to the coronal pulp and the radicular pulp. The only option here that is located in the coronal pulp are the pulp horns. All other options as seen here are located in our radicular pulp. Okay, on to the next question. Which of the following molars can have 3 cusps? Alright guys, pause the video. And the answer is of course the maxillary third molar. Remember, the maxillary third molar is the only molar that can have 3 cusps. All other molars will either have 4 or 5 cusps. Okay guys, let's do a quick recap of what we went over in this video. First, pulp forms from the dental papilla and can be divided into the radicular and coronal pulp once matured. Secondly, the law of concentricity can be applied to dental pulp. And finally, teeth have characteristic cusps and grooves, some of which are important for you to remember. Alright guys, that's it for today's topic. Thanks for watching and see you next time.